Okay. Hey everyone, thank you for joining us today. We are here with Nick Orser doing a webinar on patient matching algorithms for the PMIX Education Subcommittee. This is one of our technical bite presentations, so we will be sending this out to everyone, and it will also be recorded and posted on our YouTube page. Thank you, Nick, for joining us today. We're really excited to have you. Please allow me to introduce him. Nick Orser is the Senior Director of Solutions Consulting at Verado, where he helps customers understand how Verado's master data management, enterprise master person index, and patient matching solutions can help power their analytics, interoperability, patient experience, provider, data management, and AI initiatives. Nick has worked at Verado for over 10 years in a variety of roles spanning from product marketing, solution architecture, and sales consulting. Nick lives in Washington, D.C. So welcome, Nick. You can go ahead and get started whenever you're ready.
Great. Thank you, Chelsea, and thanks for having me. And I'm really excited to walk through this. We'll talk through patient matching 101, and I'll walk through an agenda in just a second. But as Chelsea said, so I've worked at Verado for over 10 years. And for anyone who doesn't know Verado, we've done and specialized in accurate patient matching for over 10 years, amongst a bunch of other technologies that Chelsea just alluded to. So we have over 100 enterprise customers using us as their patient matching engines, from states and governments to health systems and payers and healthcare technology companies, health information exchanges. And a fun fact is that across those 100 customers, more than 100 customers, we're matching over 75% of the US population. So 3 out of every 4 people in the US and 3 out of every 4 people on this call or listening to this webinar, your data is being accurately matched by Verado at some healthcare organization. Now, even though I do work at Verado, I will try to be pretty generic and broad with this content and try not to say anything too Verado specific. So as an agenda, I figured we'd start with a pop quiz because, what's a webinar without a pop quiz? And we'll start with it just to kind of get everyone's brains turning and wheels spinning on why is patient matching so hard and what sort of decisions would we make when we're looking at doing patient matching. And then we'll talk about kind of what is patient matching and what are some of the challenges with it. What are the different matching approaches and algorithms? And then what are within those algorithms? What does it mean to talk about matching thresholds? How do we measure accuracy? And then I'll summarize everything. And then I think some folks sent in some questions, and I'll just try to address as many of those as we can. So let's start with a pop quiz. And if I were looking at these 2 records, one for Jessica Smith with that birth date and her social security number, a particular address and her phone, and another record that's exactly identical in every single way. And I were trying to decide for myself, do I think that these are the same person? And you should all ask yourself this question as well. Do you think these are the same person? Would you say that these 2 records are the same person if you saw one from an EHR and another from, a prescription that had been filled for a person, and these were the identifying data attributes about them that you saw across those 2 records? Would you think that these records belong to the same person? I would. I mean, the data looks exactly identical across a number of different attributes, really solid identifiers. And so, yes, I would say that these are the same person. But what if one digit in the social security number was off? Instead of 57 as that social security number, it was 56, but all the other data was exactly identical. Would I still think these were the same person? Would you? I would. I mean, that's probably just a typo, right? I mean, what are the odds that there's somebody out there with the exact same data, but just one digit off in their social security number? Next to none. What about if the address, the first 2 digits of the address were transposed? Instead of 58, it said 85. Or what if the same was true of the birth date? Instead of 18, it said 81. So the month and day were transposed. And really the question that we're trying to answer each time we're looking at these records is, what are the odds that there's somebody else out there with such similar data? What are the odds that there's somebody else out there that this record might belong to that's different from the first person? That there's somebody out there with such similar data as Jessica? Now, what if the second record said Jesse instead of Jessica? Well, that's just a nickname. If all the other data looks the same, I know that Jesse is a nickname of Jessica. So again, I might say, well, yeah, of course these are the same person. But what if I remove the phone number? Or what if I remove the social security number and I had fewer attributes that I was trying to use to make that decision? Would I still think that these were the same person? Or is it potentially that there's twins? I mean, parents all the time will name their kids Jessica and Jesse, and all the other data might look exactly identical because they're living at the same household. So they're living at the same address. So are these the same person or is it actually twins? It's a little bit more ambiguous. We just don't have enough data to make that decision potentially. Or maybe you're really confident that they are the same person, but if they are twins, then you accidentally match the wrong record to the wrong person, and it becomes sort of a challenge to untangle that. What about this? Jessica Smith with just her birth date. Well, that's a pretty common name, and so I'm not actually confident that without an SSN or address or phone number, I'm not that confident that these are the same person or not. But what about Daenerys Targaryen from Game of Thrones? Really uncommon first name, last name combination. What are the odds that there's somebody else out there with that same first name and last name? Next to none. So maybe I'm much more confident that these are, in fact, the same person. Or similarly, what about a name change and an address change? Different last name and different address, maybe using that same nickname in the first name. Are these the same person that has just changed their name after maybe getting married and moving? Or are they different people? Well, what about Pam Beasley and Pam Halpert? Well, I've watched The Office. I know that Pam Beasley got married, and I actually don't remember if she changed her name to Halpert or not, but I know that there's at least somebody out there named Pam Beasley who got married to a Jim Halpert, and maybe they got, after they moved after they got married. And so maybe I am more confident that these records belong to the same person. Now, I do all this as part of this pop quiz just to kind of get your own brains thinking about why patient matching is so challenging. What are some of the difficulties in the data that make this so hard and so nuanced? So, well, let's start with what is patient matching, just kind of at a really high level. What is patient matching? Well, as I kind of alluded to before, patient matching is what connects people to their records using demographic data as the key. It connects a person who has walked in to get registered to receive care, or who has gotten a prescription, or who has gone and gotten a lab done. It connects people, these patients, to their records that have this data about them on that record. And the way to connect a person, a physical human being, with a electronic or paper record of their medical history is to use their name and address and birth date and phone and these other identifying demographic data details to tie that record to that person. And that happens for all of us when we walk in the front door of a hospital and we say, "Hi, I'm Nick Orser, and here's my birth date and here's my address. Can you please see if, can you register me for my appointment?" And they'll register me and they'll look up to see if I already exist in their system, and they're using my name and address and birth date to do that. But more importantly, for today's conversation, patient matching is also what links data together across systems. Across systems. And often the technology that's doing that is what's called an EMPI, Enterprise Master Person Index, or some other technology that's doing patient matching or has an EMPI component of it to do patient matching within that technology. And so if you've got multiple different databases or states or prescriptions or all these different applications and databases that store these records for people, an EMPI or other patient matching tool is the thing that is using those same demographic identifying data details, names, addresses, birth dates, phone numbers, to connect all those records for all those people across these different systems and be able to tie all of that together for one individual, for one person. Now, why it's so hard is, as we just saw through that pop quiz, 30% of person identifying data, that patient demographic data that we use to identify records and match them together, 30% of patient demographic data is out of date in these systems. It's incorrect, entered with a typo or error or other inconsistency, or it's incomplete. It's missing key identifying details for that particular person. 30% of that data is out of date, incorrect, and incomplete, which just makes it really hard to tie together the right data for the right person and ask that question, is Nick Orser the same as this Nicholas Orser? So that's the fundamental challenge we're dealing with. So let's dive into that just a little bit more and explore some of the math around that. Well, 30% of data is out of date, incorrect, or incomplete. I've already said that. But what does it actually look like in reality? Well, I think we all know this. We've all experienced this. If this is me or a person in the sort of center circle here, they've got a name with a little dot that, and an N in it, an address and a birth date. And first and foremost, data changes over time. People get married and change their last name. They move and change their addresses. Or in the case of phone numbers, they move from a landline to a cell phone a few, 20 years ago. And their records from 20 years ago and the records from today might have different numbers on them. Data is entered with errors or there's ambiguities in the data. So errors like spelling errors or transcription errors or typing errors or homonyms and phonetic similarities when people are typing data about a person after hearing that data auditorily. There's ambiguities in data. So juniors and seniors who have really, really similar data or twins who have really, really similar data. There's different cultural naming conventions. Maybe names get added as a middle name instead of in two last name fields, or somebody accidentally switches the first name and the last name because of those cultural naming conventions. And then data is incomplete. Lots of people and systems and organizations don't collect SSN at all anymore, even though it's a really strong identifier for a patient's identity. Or you might be missing an email address, which is also increasingly a pretty good identifier for a person's identity. So there might be missing data or default data entries, meaning somebody has entered in an SSN of all nines or a birth date of 1/1/1900 because they didn't know the data and they had to pick something. So they just entered in a default name or address or birth date or phone number for that particular person. In fact, 18% of data changes every year because of people moving and changing addresses or changing their names. 25% of the adult population has some sort of ambiguity in their name. 6% of data is entered with errors, and 5% of data, and actually that number is getting bigger by the day, 5% of data is incomplete or missing altogether to help identify who somebody is. Now, the technologies we use to do matching then fundamentally struggle to do that patient matching because of these data challenges. If there's a Catherine Smith and a Kat Johnson, one's at 123 Main Street, the other's at 456 Elm Road, one's got the birth date, the other one doesn't. The other one has the phone, but the first one doesn't. How on earth is a matching technology supposed to look at these records and say, well, I think based on these demographic details that this is the same person? Even if it is the same person because she's gotten married and moved, it's just too hard to make that decision because the data looks too different between these records. Now, healthcare in particular has unique data challenges beyond just the data being out of date and incorrect and incomplete. Data often changes over time. We've already talked about that, but that's really prevalent and common in healthcare where you're trying to track somebody's longitudinal care journey over many years, over the entirety of their lifetime. You're not just trying to do matching for, the last 2 months. You're trying to match somebody's record to records that you might have for them from 30 years ago. You might have a lot of dummy and default data ending up in an EHR in particular. John Doe, baby boy, trauma patient are all very common names that we see within healthcare data. Twins and juniors and seniors, as I already described, but because twins and juniors and seniors, they're often coming in to get care with their family members. It's the parent bringing the twin or the junior or senior in. And so that adds to the challenge because you have a parent registering the child. And so you might be seeing the parent's phone number on the child's record. And it just makes everything much, much harder to identify. Misaligned attributes. Some applications store SSN and use it for matching. Some don't. Some have address. Some use a different format of address. Some don't have address altogether. Intentional data errors. People who are intentionally using the wrong name or address or other data to obfuscate their identity, to get care or hide who they are. And then thin records that are missing a lot of key identifying data attributes, like the record, the example we saw with just a first name, last name, and birth date. That's very common for things like lab records. And so it's really hard to identify who that person is because if it's a common first name, last name, and birth date, you're not so sure if that is the right person or if there's just going to be somebody else out there in the US who might share that same first name, last name, and birth date. And then making problems even worse is that this patient matching challenge, is exacerbated at national scale. There's no national standards, so every system, every application, every database often is using different data and different matching algorithms and criteria to make its matching decisions. And there's no standards for how that data is even formatted. So even if everyone agreed to use address in its matching logic, if the addresses are formatted differently each time, it becomes increasingly difficult to use that as an attribute, for example. There's no national patient identifier, and organizations are increasingly stopping using SSN as a way to help identify people. And so these really strong attributes that we could have to identify who somebody is, we're not using them for security and privacy reasons and a whole bunch of other political reasons as well. There's no accuracy requirements. There's no sort of national standard for how accurate a technology has to be in order to make its matching decisions. And so often you end up with different applications using different logic and different weights and different thresholds for how they match records together. And so some are too conservative and some are too lenient with how they're making those decisions. And so you end up with all sorts of challenges in that way as well. All right, so let's talk through some of the different algorithms and approaches that organizations, databases, applications use to do patient matching. And just to kind of start off and orient us with how does patient matching actually happen? If this is me walking in at registration, and here's a record that's been created for me, or me, coming in through some alternative data source, new data source, and you're trying to match my records together. Well, the thing that's doing that matching in EMPI or sometimes the EHR or other platforms, these are just sort of representative examples, but this thing that's doing the matching usually has an existing index of all the patients that it's seen, that it has tried to do matching for, that have been seen by this particular organization. And it's got that index and all of their identifying data, their names and addresses and birthdates and phone numbers that it's going to use, again, as the key to do this matching. And then it's got some algorithm that it's going to use to try to do that matching. And then it's got matching thresholds. Do I think these two records are the same person or not the same person, or am I not sure? And so this data might flow in to this EMPI with some identifying data. And the EMPI is looking at all the records in its index and saying, let me find one or more that look pretty similar to this person, this data that just flowed into the EMPI. And then let me use my algorithm to decide if I think these records are in fact the same person. And if it does that comparison and all the data looks perfect, it's going to say, well, I think that this is definitely the same person. I'm actually going to match these records together. I'm going to link them together. I'm going to add this person to the index and say, I've seen this person before, and here's who they are in my existing index. Or they might say, well, I don't know, the data doesn't look too similar. It looks maybe kind of close, but actually it looks different enough that I think these are the different people. I'm going to say this is not a match. I'm going to therefore add this incoming record as a new entry in my index. This is a new person I think I'm seeing. I haven't seen them before on anyone else in my index. Or if it's not so sure and the data looks kind of similar, but not so similar that it can automatically match those records together, it might say, well, I think this is a potential match, but I'm not so confident I'm going to automatically link these records together. And so I'm actually going to have maybe somebody manually review that through some mechanism, through a user interface, through a report, but somebody else has to come in and make this decision for me. So what are these different algorithms in that middle column? Well, there's been an evolution of matching approaches over time, and I'm going to talk about three in particular. One type of matching that has existed for a long time and still exists is what's called deterministic matching. Another type is called probabilistic matching, or you might also hear it referred to as fuzzy matching. And there have been some improvements to that over time. And then there's this little bit newer technology called referential matching. And each one of these has been kind of a quantum leap in accuracy, deterministic to probabilistic. Like probabilistic kind of changed the game in how records are matched together. It's much, much more accurate than anything else that was ever out there. And then this concept of referential matching came along and was much, much more accurate than anything else out there in probabilistic matching. So this has kind of been the evolution in these technologies, but they all still exist today. And what are they? Well, let's start with deterministic. What it is it's essentially saying, I'm going to use lots of rules to make my matching decisions. And it's in that sense, it's deterministic. It's checking against all these rules and it's saying, if this, then that, if this, then that. If these match, then I'm going to consider it a match. If all these other attributes match, then I'm going to consider it a match. And so you can look at this algorithm and say, well, what are those rules that it's using? And some examples could be, if first name and last name and birth date and address are all identical, then I'm going to consider these to be a match. And then its next rule might be, well, if that isn't true, but first name, last name, birth date, and phone are all identical, then consider it a match. And it might have dozens of those, all really well thought through and kind of increasingly complicated logic. Sometimes they're not that complicated and it is just sort of a few basic rules, but they can get kind of complicated depending on how many of these rules you want to apply. The benefits of these technologies is that because they're so dependent on the data matching really, really perfectly well, they're not usually making a lot of bad matches. They might make some, but they're not usually making a lot of bad matches, incorrect matches. The downsides are that these sorts of algorithms struggle if the data is even a little bit off for the exact same reason. If the address is off by just a little bit or it's spelled street instead of an ST, they might say, well, those are not exactly identical. I don't think that's a match then. And so the data has to be really, really perfectly formatted and aligned for these algorithms to work well. And the other complication is that usually you or somebody has to build all these rules yourself. You have to go think through, well, in my particular data set, if I don't have a lot of birth dates, then I don't want to have birth date be one of the first rules. I want to have it be one of the secondary rules. And how do I weight that compared to something like address? And should address always be a good match? Or what if you kind of have to think through all of that logic yourself and build these rules yourself. Another approach that I alluded to is probabilistic matching. Now, what probabilistic matching does is it uses algorithms and what's called fuzzy logic. Fuzzy meaning there can be some fuzziness in the data. It doesn't have to perfectly align in order for it to look similar enough for an algorithm to make a determination on it. Fuzzy logic to compare each attribute. So it looks at each attribute across each record and then assigns each attribute a different score. How much do I value a birth date versus an address versus a name versus a last name versus a phone number? Weights each attribute with its score depending on how accurately that attribute has aligned across records, and then adds all of those numbers up to try to pass a certain threshold. The benefits of this are that it overcomes minor data discrepancies. Things like typos and nicknames and phonetic similarities are often built into the algorithm, which means it has a huge uplift in overall accuracy compared to deterministic algorithms. But the downsides are it's even more complex than a deterministic algorithm because it requires a lot of tuning and weighting of the algorithm to align it to the data. How much do you want to weight a birth date versus a phone number versus an address? What happens if the address and the birth date are both kind of similar, but the name isn't? Do you consider that to be a different score? How much do you care about first name and last name as a combination instead of just first name or just last name? So it's thinking through all of that logic and assigning these different weights. And this is what that actually looks like in practice. And just for what it's worth, all the numbers on this slide are made up. Actually, all the data in this entire presentation is made up. Like there's no real person data. Robert Tyndall isn't a real person. But in particular on this slide, all the numbers are made up in terms of this, but it's illustrates the point. Now, if I've got record A and record B and I'm a probabilistic algorithm, I'm going to look at Robert Tyndall and I'm going to look at Rob Tyndall. And I'm going to say, well, the fact that there's a nickname is going to get a 9 out of 10, maybe possible points for first name. 10 out of 10 would be perfectly spelled Robert, but our nickname is pretty accurate. And so maybe that's a 9 out of 10 on first name. Similarly, the last name having phonetic similarity, Tyndall with an I versus Tyndall with a Y, or maybe that's just one character off that's been mistyped. Maybe that gets 7 out of 10 possible last name points. On month, date, transposition, and the birth date might get 9 out of 14 points. 14 because birth date's maybe a little bit more trusted as an attribute than first name and last name independently. What's called an Levenstein edit distance, meaning it's just one character off, might be in the phone number. And how much does that add up to? Well, 5 out of 6 possible phone points. And same thing for the address, 5 out of 7 possible points for a transposition in that address. And so if you were to add all that up, you get a total score of 35 out of 47, which is kind of, again, just for illustrative purposes. But if my match threshold was 35 or lower, then getting a 35 means I've met that threshold and I would consider this to be a good match. If my match threshold is 36 or higher, then this would fall below that good match score and it would say, well, I don't think these are the same person. I'm not going to match them together. That's effectively what probabilistic matching algorithms are doing. They can overcome some of this data fuzziness, but someone has to really think through how much each of these attributes should be weighted in the overall match score. The last approach is called referential matching. And what referential matching does is it combines probabilistic algorithms with highly curated identity data that then informs those algorithms. And I'll show you what that looks like in an example as well. The benefits to referential matching is that it overcomes minor data discrepancies because it's still using probabilistic algorithms, but it can also then overcome major data discrepancies. name changes, address changes, records that are missing key identifiers. And so you see this huge uplift in accuracy over probabilistic algorithms alone that don't have this referential matching capability. And because it's already kind of tuned using this curated identity data, and you'll see what I mean in just a second, it often doesn't require any extensive tuning of the algorithm. It's often just accurate out of the box. And you can tune it if you'd like to, but it's just going to be the most accurate thing out there. The downside, maybe the only downside to referential matching, is that only a few vendors do it. And certainly not a lot of do it very well. Verado, I'm proud to say, we have pioneered this technology in the market. And so we are one of those vendors that does it, and we do it exceptionally well. We've pioneered this technology in healthcare. So what does this example look like? Well, again, if I were to compare record A and record B to each other, this time for Rebecca Smith and Rebecca Jones, one's got the birth date, the other has the social, different phones and different addresses. If I'm any other EMPI or EHR or other patient matching technology, I'm going to look at these two records and I'm going to say, well, I don't think these are the same person because the data just looks too different between these records. But what referential matching does is it looks at a curated reference database of existing identity data. So it can look for things like name changes and address changes and phone changes, and has this superset of data about Rebecca, including those name changes and address changes and phone changes, including her birth date and her social security number. And so even though this record A and this record B don't look anything like each other, they both match to the same identity in this reference database. And so referential matching can say, well, I know they look different, but I know that there's only one person out there that has all of this data. And so I can match Rebecca's records together confidently, despite the differences in their data, using this reference database kind of as the key during the matching process. And it's a secure database. It contains identity data history, name and address changes. It's used only to inform matching decisions for healthcare use cases. It's not sourced from healthcare, it's sourced from non-healthcare commercially available data sets. And it's not ingesting customers' data. Often you should check with your vendor if you're using this, but it's not ingesting customer data, at least for autos isn't, into the reference database. All right, so let's talk about these matching thresholds. What do I keep meaning when I'm saying matching threshold? And we already kind of talked through this. A matching engine will be looking at two records for two different people or two different records and trying to determine if they're the same person. And that algorithm might say, well, they definitively match, they're the same person. They definitively don't match, that's a new person. Or I'm not sure, maybe this needs to be reviewed by a data steward. And the way to think about matching thresholds is that if you were to kind of plot matches that should be made and should not be made, they often kind of fall into these categories where oftentimes there's very similar data, and a lot of that very similar looking data is matches that should be made, but sometimes maybe they shouldn't be made. And we'll look at what that looks like in just a second. And that's kind of an independent vector of what the match score is, an independent dimension of what the match score is. Like the match score might be really high, and if the data similarity is really high, then that means they're the same person. So let's look at what that actually looks like. A match score will say, well, if you meet my existing confident match threshold, then I'm going to consider these to be good matches. I'm going to consider these to the left of my no match threshold to be not matches. But you can see that this match threshold, the way it's been set, is maybe incorrectly saying that there are some records that look really similar and fit the match score, but are actually different people. And so they're false positives. These are matches that should not be made, but the data looks kind of similar. And so they kind of meet that match score threshold. And so they're false positives. They're bad matches that the algorithm should not have made. They belong to different people. They're records that belong to different people, but the algorithm matched anyway because it exceeded the upper threshold, even though they belong to different people. And they exceeded that threshold because the data just looked really similar. Similarly, on the opposite side of the spectrum, there's these no match decisions that shouldn't be made. You know, records should not be matched together. But there are some records that should be matched that fall below that threshold as well. And so those are false negatives, records that have not been matched together but should have been, even though their data didn't look very similar. And that's a good example of that Rebecca Smith versus a Rebecca Jones with two different addresses and two different phone numbers. That data didn't look very similar. And so it didn't get a very high match score, but it's a match that should have been made. It is actually the same person. And then falling in this middle here are these tasks, these potential matches. And so to overcome false positives and false negatives, you can just kind of adjust your thresholds in kind of any direction. But in this case, you can adjust your definitive match threshold up to make fewer confident decisions and end up with a lot more tasks, but at least you're not making any false positives. And you can adjust your lower threshold down to find more of those missing matches, those mismatches, but then you're also creating a lot more tasks. And so it kind of depends how you want to set these thresholds, kind of depends on your own personal preferences and how you want the technology to be running and what your tolerance is for bad matches or missed matches. And depending on what your tolerance is for all of those and how your data looks and where you set these, like that's going to inform where you want to actually apply that threshold on your data. All right, so we kind of touched on false positives and false negatives, and that gets us into this question of how do we actually measure accuracy of all those matches that should be made and you are making some, and all the matches that shouldn't be made and you're not making some. How do you actually account for that and measure that? And the answer is it's incredibly complicated. And not the math. The math is actually reasonably straightforward. What makes it complicated how to measure accuracy is that there are too many ways to measure it. But I'll tell you the two most common, just so you can sort of have a mathematical sense, sort of an intuitive sense of what people mean when they talk about patient matching accuracy. The first most common way of talking about patient matching accuracy is something called precision. There's another term for this called positive predictive value. And if you've ever studied statistics, you know way more about this than I do, no matter what. So just, bear with me while I stumble my way through describing precision and recall. But what precision is saying is it's effectively a measure of how often a incorrect match is made, a false positive. And that number for patient matching should be very high. So a precision of that's meant to be all nines instead of that zero in there, but a precision of 99.99999 means one false positive for 1 million records, one false positive per 1 million records. And that's industry standard for healthcare typically. Recall is kind of the two sides of the same coin, precision and recall. Recall is the other side of that coin. It's also called sensitivity. It's a measure of how often a false negative is created. And you can see, based on the slides we just looked at, they are really two sides of the same coin. If you want to capture a lot more matches, you're going to increase your risk of false positives. If you want to decrease the number of false negatives, you're going to increase your precision and decrease your risk of false positives. You're going to increase your risk of false negatives and missing out on good matches. So this precision and recall are really two sides of the same coin. And optimizing for one, I want to eliminate false positives, means sacrificing the other, or it means creating tasks, these sort of potential matches that need to be reviewed by a person. And usually, as I said, patient matching algorithms are actually optimizing for precision because you really can't accidentally match the wrong records together for the wrong people in healthcare. It's either a HIPAA violation or it's a big, sort of security breach, or like it leads to a bunch of negative effects sort of on the compliance and security and privacy side, but it also impacts patient care because then you might be treating somebody under the assumption that they've got a particular allergy or they're on a particular medication when they're not. You're actually basing that decision on data that belongs to somebody else. Just the last thing I'll say here, there are other mathematical ways to measure accuracy. And there are a lot of ways, as I already said, but precision and recall are the big ones. What makes it so complicated is introducing things like tasks and introducing things like, how do you actually truly account for that? Like someone has to go measure and actually determine, looking at samples, how often an algorithm is behaving correctly or it is not behaving correctly. And then you have to adjust it and tune it one way or the other, finesse the thresholds to achieve your outcomes. All right, so just to summarize everything we've learned today, because we've covered a lot, but just to summarize everything, patient matching is this concept of using demographic data, names, addresses, birth dates, phones, and other details like that, to both match a person to their records, match the physical human being to records that belong to them in an electronic system, or match that person's records together across those different electronic data systems. between an EHR and a CRM, between different multiple EHRs, between states and state PMP programs. A master person index, or MPI, or enterprise master person index, EMPI, is a software tool that is the thing that's often doing the matching, using its rules or algorithms in order to build a single list, a single index. That's why it's called a master person index of all people and all the records that belong to those people. A matching algorithm is a tool that an EMPI or EHR likely uses to do its matching. So one approach we talked about was deterministic matching, which is kind of a basic approach. It uses a lot of rules to make matching decisions. We also talked about probabilistic or fuzzy matching, which is a type of matching algorithm that uses mathematical probabilities to overcome things like typos and nicknames and phonetic similarities and other minor data discrepancies by weighting how much each attribute should influence a matching decision and how much each of those different typos or nicknames or phonetic similarities or other data discrepancies should impact how much that weight is applied to the matching algorithm. A referential matching algorithm is a type of algorithm that combines probabilistic algorithms with this nationwide data set of identity data to overcome name changes and address changes and other major data discrepancies. And then we also talked about thresholds, the confidence level at which records need to match or need to be considered no match or need to be considered a potential match. We talked about false positives, or what's sometimes called overmatching, which is incorrectly matching records together for different people, and false negatives, or undermatching, which is incorrectly missing a match for records that do belong to the same person, but the EMPI or other technology hasn't accurately identified that they belong to the same person. And then the last thing we talked about was this concept of a potential match. And there's a lot of terms for what you might hear in the industry for what that's called. You might hear words like potential match or potential duplicate or match task or task queue or exception queue or manual review queue. Those all kind of mean the same thing. And so people refer to this concept in many different ways. But those are all ways of talking about these records that look kind of close, but not so close that the algorithm is automatically matching them together. And often those are getting flagged for a person to make that decision manually, to review them manually and say, do I, a person smarter than this algorithm, think that these records actually belong to the same person? All right, so I know some questions were sent in for Q&A, so I'm just going to tee those up. I wrote them down, and I'll just go through them. And I also combined some of these that were sent in that looked kind of similar into one question that I'll address sort of simultaneously. Which combination of data elements has historically produced the strongest confidence levels, or what's the most useful fields and least useful fields? It kind of depends on your data and the algorithm that your vendor is using, but in general, attributes like name and birth date and social security number, if SSN is available, those are typically the most important to have to make a confident match. Address and phone are often close behind and they're good indicators, but they also often point to people that might live in the same household but have similar data. And so it can get really nuanced of, are these just, is this the same person or is it people with similar data, juniors and seniors or twins that live in the same household? Attributes like gender and email tend to be a little bit further away. Gender, because it doesn't tell you a lot about how accurately that, whether or not that actually belongs to one person. And then email, because lots of families share email addresses and it's not always collected. So things to think about when you're talking about which combination of elements produce the strongest confidence levels are, again, as I said, how families are often sharing addresses, phones, and emails, and then these typical data patterns that might look similar but belong to different people, twins and juniors and seniors and other things like that. What are the pros and cons of overmatching and undermatching? Well, in healthcare, it's very common, as I said before, it's very common to err on the side of caution and to prevent overmatching, meaning not making as many matches in order to not incorrectly match different people's data together. I actually don't know if that applies to PMP workflows and data and how important it is not to get a match wrong in those sorts of workflows. But typically the risk of incorrectly associating the wrong data with the wrong person is too big in healthcare. That risk is too big because it could, again, mean privacy violations, incorrect prescriptions or allergies being associated with that person. Now, on the flip side, If you don't associate all of a person's records together, their medications and their allergies and that sort of data, then that might mean making the wrong clinical decision on them, just like if you incorrectly associate different people's data together. So neither one is really good, but healthcare really tends to skew towards never overmatching records, even if that means sacrificing matches that should be made. Um, what are some of the most recent or biggest changes you or the industry has made to the algorithm that has made a positive impact? This referential matching thing that I talked about earlier, that's been a big push. It's made a huge difference in a lot of organizations in terms of how many more matches they're able to capture without sacrificing the accuracy, without sacrificing their precision, without overmatching records. So it allows you to make significantly more matches and have this algorithm that's still erring on the side of caution because it's healthcare. Um, and then the fourth question is, how does machine learning aid in patient matching? And another similar question was, what do you foresee AI will bring to patient matching? Um, Machine learning and AI are both important here, and there's maybe three categories and ways to think about that. One way that they help is simply by improving the algorithm. So AI and machine learning can be really good at overcoming things like name variations, for example, or understanding how common those names might be. Um, the one thing I'll say though is just bear in mind that AI cannot do patient matching very well at this point. Just like how every once in a while your AI hallucinates and tells you the wrong information when you're Googling something or when you're asking ChatGPT something. So you don't want a matching algorithm to once in a while make a big mistake like that, or to sometimes make one decision, sometimes make a different decision when it's seeing the same thing. And so I would just caution you for any vendor that's talking about building an AI powered matching algorithm, whether or not that's going to be scalable and repeatable, and it's going to be accurate at the scale and repeatability that healthcare needs it to be. But it is good at some things, and you should be asking any vendor that you're working with whether or not they're using AI and how they're using AI in their particular algorithm. So that's sort of one category. Another way that AI can help is simply by making the review and resolution of those potential matches easier. So as I said, there's this threshold where everything's a good match. There's a threshold where it's not a match, and there's this sort of gray area in between where it's a potential match or a potential duplicate. And if you're a data steward or a person who's tasked with going in and reviewing that and manually resolving that, wouldn't it be great if AI could help make your decision by informing you with how others have made similar decisions in the past or that sort of thing? So simply by making the review and resolution of those sorts of potential matches easier, AI can have a huge impact. And then the third way that AI and machine learning can impact patient matching is by how you actually interact with the algorithm. And what I mean by that is right now, a lot of EMPI and EHR software is accessed through APIs, through HL7 messages, through these other, batch files, these other sort of data formats. You need to be able to ask the EMPI a question. And the way to do that is by submitting that data or that question through an API or through an HL7 message or through a batch file. Um, but now those same tools can be accessed through AI agents who need information about a matching decision done in real time as part of a particular workflow they're working on. So if you're thinking through how agentic AI workflows can improve, something you're working on, and that thing you're working on, that workflow needs an accurate matching decision, needs an accurate index of all the records that belong to a particular person. Now AI can interact with these EMPI and other technologies to get that information in a much more much easier way for AI agents to operate. All right, so unless there are any other questions, Chelsea, from your side, I will wrap up and just say a quick thanks, and feel free to email me. There's my email address. If anyone has additional questions or wants to go deeper on any of this stuff, feel free to reach out.
Perfect. Thank you so much, Nick. That was really great information. I know that all of our PMP administrators are going to love this webinar. Again, it's a topic that's often brought up in our community, and I think just a basic level of understanding is going to be extremely helpful for them to understand maybe why some patients might match and why other ones might not hit that patient matching algorithm. So thank you again. For coming on, and I hope you have a great rest of your day.
Thanks, you too.
Thank you.